If you know someone who takes prescription opioids like Percocet or Oxycontin, or illegal opioids like heroin, then you should know about the risk of an accidental, life-threatening opioid overdose. In fact, over 56% of overdoses happen in private homes beyond the immediate reach of doctors and nurses. There's a way for you to help someone who is experiencing an opioid overdose, even if you don't have specialized medical training. In this video are instructions for use, as well as the uses and safety information you should know for using Narcan. But first, it's important to be able to recognize the signs of an overdose. Signs of an opioid overdose include not waking up or responding to your voice or touch, breathing that is very slow, irregular, or has even stopped. The dark center part of the eyes becomes very small, sometimes called pinpoint pupils. Fingernails and lips turn blue or purple, a slow heartbeat, weak pulse, or low blood pressure. If someone has these signs, here's how you can help. Narcan nasal spray is a medicine that reverses the effects of an opioid overdose. Narcan nasal spray is not a substitute for emergency medical care. Repeated doses may be necessary. As with any drug, you need to be aware of important safety information about its use. Please pay particular attention to the indications and important safety information at the end of this video. Also, please see the accompanying full prescribing information in the use of this product. Narcan nasal spray was designed for use wherever an emergency opioid overdose happens. Because it doesn't require specialized medical training, it can be given to someone by following these instructions. First, lay the person on their back. Then, remove the device from the box and peel back the package. Hold the device with your thumb on the bottom of the plunger and 2 fingers on either side of the nozzle. Tilt the person's head back and provide support under their neck with your hand. Place and hold the tip of the nozzle in one nostril until your fingers touch the bottom of their nose. Press the plunger firmly to give the dose into the person's nose. After giving the dose, remove the device from the person's nostril and move them on their side, positioning their hands under their head. Call 911 and get emergency medical help right away after giving the first dose of Narcan nasal spray, even if the person wakes up. Narcan is not a substitute for emergency medical care. Keep the person under observation. If the person doesn't respond by waking up to voice or touch or breathing normally after 2 to 3 minutes, administer the second dose provided in the box in the alternate nostril. If they respond and the signs of an opioid emergency have returned after Narcan nasal spray is given, then give another dose in the alternate nostril using a new device and watch them closely until emergency help is received. Additional doses may be given every 2 to 3 minutes until they respond or emergency medical help is received. After using Narcan nasal spray, put the device in its box and then dispose in a place safe from children. Narcan nasal spray delivers a consistent, concentrated 4 mg dose of naloxone that can reverse the effects of a life-threatening opioid overdose in minutes. Visit Narcan.com to learn more. There's a way for you to help someone who is experiencing an opioid overdose, even if you don't have specialized medical training. Indications and important safety information. What is Narcan nasal spray? Narcan nasal spray is a prescription medicine used for the treatment of an opioid emergency, such as an overdose or a possible opioid overdose with signs of breathing problems and severe sleepiness or not being able to respond. Narcan nasal spray is to be given right away and does not take the place of emergency medical care. Get emergency medical help right away after giving the first dose of Narcan nasal spray, even if the person wakes up. Narcan nasal spray is safe and effective in children for known or suspected opioid overdose. What is the most important information I should know about Narcan nasal spray? Narcan nasal spray is used to temporarily reverse the effects of opioid medicines. The medicine in Narcan nasal spray has no effect in people who are not taking opioid medicines. Always carry Narcan nasal spray with you in case of an opioid emergency. Use Narcan nasal spray right away if you or your caregiver think signs or symptoms of an opioid emergency are present, even if you are not sure, because an opioid emergency can cause severe injury or death. Signs and symptoms of an opioid emergency may include unusual sleepiness and you are not able to awaken the person with a loud voice or by rubbing firmly on the middle of their chest, breathing problems including slow or shallow breathing and someone difficult to awaken or who looks like they are not breathing. The black circle in the center of the colored part of the eye is very small, sometimes called pinpoint pupils, and someone difficult to awaken. Family members, caregivers, or other people who may have to use Narcan nasal spray in an opioid emergency should know where Narcan nasal spray is stored and how to give Narcan nasal spray before an opioid emergency happens. Get emergency medical help right away after giving the first dose of Narcan nasal spray. Rescue breathing, or CPR, may be given while waiting for emergency medical help. The signs and symptoms of an opioid emergency can return after Narcan nasal spray is given. If this happens, give another dose after 2 to 3 minutes using a new Narcan nasal spray and watch the person until emergency help is received. Who should not use Narcan nasal spray? Do not use Narcan nasal spray if you are allergic to naloxone hydrochloride or any of the ingredients in Narcan nasal spray. What should I tell my healthcare provider before using Narcan nasal spray? Before using Narcan nasal spray, tell your healthcare provider about all of your medical conditions, including if you have heart problems, are pregnant or plan to become pregnant. Use of Narcan nasal spray may cause withdrawal symptoms in your unborn baby. Your unborn baby should be examined by a healthcare provider right away after you use Narcan nasal spray. Are breastfeeding or plan to breastfeed. It is not known if Narcan nasal spray passes into your breast milk. Tell your healthcare provider about the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of Narcan nasal spray? Narcan nasal spray may cause serious side effects including sudden opioid withdrawal symptoms. In someone who has been using opioids regularly, opioid withdrawal symptoms can happen suddenly after receiving Narcan nasal spray and may include body aches, diarrhea, increased heart rate, fever, runny nose, sneezing, goosebumps, sweating, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, stomach cramping, weakness, increased blood pressure. In infants under 4 weeks old who have been receiving opioids regularly, sudden opioid withdrawal may be life-threatening if not treated the right way. Signs and symptoms include seizures, crying more than usual, and increased reflexes. These are not all of the possible side effects of Narcan nasal spray. Call your doctor for medical advice about side effects. The risk information provided here is not comprehensive. To learn more, talk about Narcan nasal spray with your healthcare provider or pharmacist. The FDA-approved product labeling can be found at www.narcan.com/pdf/narcan-prescribing-information.pdf or 1-844-4NARCAN. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including the patient information for Narcan nasal spray.